I'm going to take the cynical view for a moment on something happening. The climate, the tax breaks sunsetting, unwinding a war, the economy, health reform. There are some who say the next president will have to actually break his pick on the issue. It'll have to be a disaster so that in 2012, whoever comes in can actually get something done because they'll have a mandate. What gives you hope with all of that, that something actually really can and will happen that's meaningful?
I think a lot of us would argue that that while we're in these immediate crises of the war, the economy, all of these other ones, for American families who are either uninsured or who are paying very high insurance premiums with high deductibles, so a lot of out-of-pocket costs for their health care, on a personal level, they are feeling that crisis in their family. Members of Congress are hearing that from our constituents, and I think on the campaign trail, you folks are hearing it too. So for the American people, health care is a personal crisis that they're feeling. It is true that the next president will have very large international issues to deal with, which is why I think the argument is even stronger that they will need to have to work hand in hand with Congress. My committee, for example, and Jane's committee, the Energy and Commerce Committee, we don't do war funding. We don't do these other issues. We do health care. And so I think the next administration will have to sit down and develop health care legislation collaboratively with their allies in Congress. And I guess we'll loop the Senate in too. But it seems to me that we should that we should really look at this as a challenge that is going to impact average Americans' lives. And I think that I talked about a lot of the barriers because they are high, but I agree completely with Chris that if you try to nickel and dime this thing, you're never ever going to solve it because it would be too complex, and each discrete issue will fall of its own weight. So we really do have to exercise that leadership. And I also agree that as well as within the stakeholders in Washington, there's a great hunger with members of Congress to actually sit down and have a big debate about health care.
Just very quickly, I guess I believe that you can't do budget, economic, and even tax reform well without dealing with health care. It just, you can't just silo healthcare. Oh, never mind. It has nothing to do with taxes, has nothing to do with budgets, has nothing. It actually has everything to do with all of those things. And to the extent we silo it will be the extent to which you will know that we won't be doing comprehensive health reform. To the extent that it gets integrated in the economic and tax reform policy debate, which is inevitable in the next Congress, then I think there is a chance. I guess the last thing I want to say is that what always happens with a new president and a new Congress is a sense of opportunity and possibility. And it really is going to be up to that president to set the stage. And that's just to Mark's point, that it won't happen if that leadership vision isn't there. It can't be top down, as Diane suggests, but it has to be laid out there and hard. And I would suggest that you can make the case that you can't do any of these other things well without health care. And to that extent, you might be able to see substantial reform happening.
I want to echo a lot of what Chris just said. I think there are days when I look at the agenda that you laid out, and it's just overwhelming. How much that needs to be accomplished. But if you look at the things that run together, they are the economy and health. You can't separate those. Our international competitiveness is impacted by the way we do healthcare. Families are stressed, and you hear it all the time. So you cannot separate the economy and health. You can't, in my view, separate the tax system and health. That's not going to happen. So, you have to deal with that, deal with it comprehensively. The other competitor that you mentioned, climate change, is real, and but there, it feels very different to me. What's driving the timetable there is the international the UN process and the need to get on ahead on that. But I don't think the American public is as far along in the realization of the seriousness of the problem and acceptance that things are going to have to be done in that. There's a lot more education to be done. That's my deep instinct on that. It'll be harder to move. So I think healthcare rises for that reason. And there is a lot of consensus about the problem. I mean, Peter said it exactly right. The problem is not really all that difficult to understand. If you could save the $700 billion through a variety of care reforms, you could take the 50 million uninsured and give them a $12,000 health insurance policy. That's $600 billion. That's the goal. Improve the value proposition, insure more people.
I think it's interesting that I think there's a broad array of agreement on, I'd say, and someone tried to quantify it, but on say 90% of what needs to happen. And the problem is everyone has the other 10% they all differ on. And so the question becomes, how can you create a political structure where you reach agreement on that 10%, because if not, that will impede at the end. It is easy, just like it's easy to talk about tax reform, everyone's in favor of tax reform, and then when you start getting down to the details, it falls apart. The same thing could occur here unless we think hard about how to reach agreement on that other 10%. And in fact, I was intrigued. There was a discussion that the Senate Finance Committee had, I think 2 weeks ago, at which Senator Baucus basically said, look, I don't feel qualified to be making lots of these specific decisions about the reimbursement rate for durable medical equipment, this, that, and other thing. Plus, I'm just lobbied to, it's the classic political economy of a concentrated interest and widespread effects. I'm lobbied very heavily on it. So why not create, according to him, some sort of federal health board that both creates technical expertise and political insulation, perhaps to get us the other 10%, just as a thought. It would obviously be a massive change in the way that we conduct healthcare policy in the United States and a massive change in the power of the Congress. But you can imagine we already have a Medicare Payment Advisory Committee, MedPAC, that makes recommendations. The problem is they're only recommendations. If instead they were actual policies that the Congress could vote up or down as a whole, the world might look a lot different.
Can I just respond to that? I think that that's an interesting idea, but we already do have advisory commissions, and we have CMS that's supposed to be deciding reimbursement rates for durable medical devices and other rates. I think you would have a harder time passing some kind of independent board that could make binding decisions, taking away congressional power, than you would actually trying to get legislation through Congress. I think you'd have a big debate over creating some independent board when you should be having the debate over health care reform. That's just my view.